Germany's highest mountain, the Zugspitze, has just opened for the winter season under special coronavirus restrictions. Only people who are fully vaccinated or recovered from the illness have access to the slopes. I'm wearing gloves, ski goggles and a face mask, so I feel quite protected. The rules up here also apply in other parts of Germany, where you need to be either vaccinated or recovered to attend a concert or visit a restaurant or shopping mall. There's a growing support for making vaccines mandatory. Nearly 70% of Germans back such a move. They believe stricter rules are necessary to break the fourth wave, which threatens to break the country's healthcare system. Welcome. Today, Germany set a tragic new record. More than 100,000 people have now died of COVID-19. Meanwhile, the infection rate is going through the roof. 76,000 new cases were reported within just one day. Pandemic fatigue and too many who refuse to take the vaccine are forcing Germany and its neighbour Austria to adopt stricter measures. Too little, too late.
Vienna is preparing for a festive season. But will this be the happy Christmas so many are hoping for? A drastic rise in COVID-19 infection numbers has cast a dark cloud over the weeks to come. The Austrian government felt compelled to act. It initially introduced a lockdown for unvaccinated people, allowing them only to leave their homes for certain essential purposes. Some say this was just a way of forcing people to get vaccinated under another guise. Others question whether the lockdown can be effective.
It could work if it were verifiable, but it's unlikely to be the case. It's hard to put into practice.
We came by subway. I'm not even sure if they check there. No, nobody. Up till now, over the past 2 days, nobody checked me, and I was also in shopping centres.
Having more people vaccinated could ease the situation in hospitals, already working at maximum capacity. This is one of more than 10 vaccination centers in Vienna. Here you can get your first, second, or third jab without needing an appointment. And suddenly more people are keen to do so. In Austria, about 64% of the population are fully vaccinated. That's one of the lowest rates in Western Europe, and it's not high enough to stop the surge.
A lot of people need to be vaccinated now for their everyday lives, for their job, or for private things, to go out for a meal in the evening, to go to the cinema, and that's why we're seeing a significant increase in vaccinations.
But most of the people here have come for a second or third jab. Only around 20% are getting their first shot. And that percentage has to increase, experts say, to turn the tide.
Dr. Katrin Schmelz is a behavioral economist and psychologist at the Cluster of Excellence, the Politics of Inequality at Constance University and the Thurgau Institute of Economics, and she joins us now. Good to have you with us. I know that you studied people's attitude towards getting vaccinated already since the beginning of the pandemic, and you found that compulsory vaccination actually reduces people's willingness to get vaccinated. How come? Why is that?
Yes, it's important to notice that we studied people's agreement with being vaccinated, not their compliance. So we asked whether people are okay with being vaccinated. It could be that you get vaccinated because you are forced to, but you don't want to. And this is what we study. And why are people more happy being vaccinated if it is voluntary than enforced? Well, two important reasons is the lack of autonomy. People strive for autonomy. We know everyone who has children has this experience, and mandates restrict autonomy. And the other reason is moral disengagement. So people feel morally obliged to do the right thing, to get vaccinated, for example. But if the government takes this responsibility, this crowds out the feeling of moral responsibility. Now we could say, well, we are. Okay.
But we've been in situations, similar situations before, and there was compulsory vaccination when it came to smallpox. That was accepted in West Germany right up until 1976. So why is it a no-go now when it comes to COVID-19?
So the vaccine is new. there is a new method, the mRNA method. So people are unsure about long-term effects. That's a different situation, but maybe with the smallpox, it mainly hurts children. And with COVID, mainly older people are at risk. And in Germany, we have the not so nice situation that older people are not so well integrated in the families. And maybe, people would care more about their children than about the elderly.
Of course, there's this big discussion about the legality now in the year 2021 when it comes to making vaccination compulsory. If we just take a quick look at the most quoted paragraph in German law for our viewers to better understand, because the basic law for the Federal Republic of Germany, Article 2, says, 1, everyone has the right to the free development of his personality, provided that he does not infringe on the rights of others. And then 2, everyone has the right to life and physical integrity. The freedom of the person is inviolable. It goes on then, but basically the problem is that it gives both sides the argument that they need, saying it's my personal decision, or saying no, it's not your personal decision because unvaccinated people are a danger to others. That's a dilemma. How likely is it that people who are not vaccinated can still be convinced?
So according to our data, it is quite likely. We find that only less than 5% are consistently opposed to voluntary vaccination overall the pandemic. All the others change their mind. So there is a lot of dynamics going on in vaccination attitudes. By the way, this hardcore of resistance is much larger in case of enforcement, but there is room for persuasion. People act upon their beliefs. So we see that beliefs about vaccinations change, and the important beliefs to change are the belief in the effectiveness of the vaccine, trust in government, and the idea whether an enforced vaccination restricts your freedom, or one could say, on the other hand, if everyone gets vaccinated, maybe due to enforcement, it increases everyone's freedom.
How big a role does history play? I've done some research, and National Socialists were opposed to vaccination. Anti-Semitism played a role there. Compulsory vaccination, on the other hand, was normal in the former East German state, the GDR, where today we see a particularly high number of anti-vaxxers. That's interesting.
Yes. We have data which are a bit counterintuitive, maybe at first glance. So we see that older East Germans who have experienced themselves the coercive regime of East Germany are less opposed to vaccination mandates, and overall to mandates with respect to COVID policies which have parallels with their own experience in the GDR, like travel restrictions also. And they are less opposed in the case of mandates than older West Germans of the same age. Now, of course, we observe the different vaccination rates in the two places, and there is another layer, which is support for the AfD. So even before the pandemic, young East Germans felt left behind in Germany, and there was a lot of support for the AfD, which also supports the anti-COVID demonstrations. So there's another process going on.
All right. So a lot of issues there at play. But thank you so much, Dr. Katrin Schmelz from the Konstanz University and the Thurgau Institute of Economics for explaining it to us. Thank you. Time now for one of your questions. Over to Derek Williams.
What is the likelihood of SARS-CoV-2 becoming seasonal and endemic?
I'd say pretty much every expert of note now believes it's kind of inevitable. But to explain why, we need some definitions first. COVID-19 is currently a pandemic, an infectious disease affecting people on a worldwide scale. And as we've learned yet again here in Europe in the last few weeks, with very unpredictable fluctuations that we call waves. With endemic diseases, numbers of people being infected and landing in hospitals are fairly constant in populations over time, enough so that we can at least ballpark predict patterns of transmission, like we can, for instance, with seasonal flu. It's an endemic disease that we know will generally affect more people in the wintertime, and we can broadly forecast how many, which helps us to manage it to some extent. No one really knows yet how long it'll take COVID-19 to reach that status because it'll depend on a range of factors. The number one factor is how many people acquire at least some immunity to it, which involves either getting infected by the virus or vaccinated against it. And how long-lived that protection proves to be is another big part of the puzzle. Vaccine distribution and take-up varies widely in countries across the world, so experts say that pandemic numbers won't stabilize everywhere at the same time. But at some point in the future, after enough people acquire some immune protection to SARS-CoV-2 through infection or vaccination, and barring the appearance of aggressive new variants, of course, researchers think that COVID-19 will begin to affect more predictable numbers of us every year at somewhat predictable intervals, like with seasonal flu, which strikes hardest in winter when people spend a lot more time indoors.
And a quick look to Latin America, where military doctors and nurses protested in Peru against what they allege are dangerous conditions that are leaving them vulnerable to COVID-19. They rallied in the capital, Lima. The protesters say the government isn't giving them sufficient protective equipment or medical facilities. They say they're forced to treat COVID patients alongside other patients, increasing the risk of cross-infection. And that's all for this edition of our COVID-19 special. From me and the team, as always, thanks for watching. Stay safe, stay healthy.